trivia is really an absolute outrage. My view, the mistake that the Obama administration made was that they didn't have a policy as to how to put these people on trial. They are enemy combatants. Some of them we cannot bring to trial, but we cannot release, and there's no overall policy yet associated with it. Thank you. Yes?
Thank you, Senator McCain. I am an emergency nurse. It's something that I've done for the past 43 years. And
Thank you for all you do.
I can say that all you have to do is stand in an emergency department for an hour or two, and you can see the problems that are inherent in our healthcare system. One of the biggest problems is that patients can't get to their primary care physician. And any healthcare reform has to, as you said, improve access to family practitioners. And then from a personal point of view, it's expected that in 2020 we're going to be over 1 million nurses short in the United States.
Could I ask you a question?
Yes,
in your duties, do you see a lot of this problem that I was talking about readmissions, people?
Every single problem you have mentioned, I have seen, and I see daily. So I agree with all of your issues on healthcare reform. As a nurse, it's hard for me to know all the fiscal answers, and I would leave that to your expertise and the experts that you use. But from a nursing point of view, I definitely would like to see more primary care physicians.
How do you, in your view, can we, one, get more people in the nursing profession, and two, more primary physicians?
From a nursing care perspective, most of the nurses my age are retiring, and that includes faculty. Last year, almost 100,000 qualified applicants were turned away from nursing schools in the United States because there were not enough faculty to teach them. So there does need to be some fiscal responsibility to increase nursing going on to become faculty in nursing schools. And
then we do this through financial incentives?
Certainly through financial incentives, giving back to the community, nurses that are willing to take positions in faculty and work in areas that are underserved to get more nurses in the United States.
Thank you very much.
You're very welcome.
Quickly respond and then continue. I agree with you. I hold no brief for much of the practices of the insurance companies in America, don't get me wrong. And we have to fix the pre-existing condition situation, and we don't shout at my town hall meetings. So I agree with you. We have to address the issue of people with pre-existing conditions, people who are unable to obtain health care insurance, and we should do it through risk pools, and it's going to cost money. Go ahead.
All right, the other thing is Mayo Clinic that you talked about having good practices is one of the ones that President Obama has cited as being the type of medical facility that we should pattern our healthcare reform on.
They just don't agree with his proposals. Go ahead.
They suggest some of the same things that the Mayo Clinic is doing, and I have some experience with the Mayo Clinic. My husband, who was on Medicare, chose to stay on just a regular Medicare, so he had the choice of going to Mayo's. I chose an HMO at Medicare, and I'm wondering, when we have that choice with our government-provided Medicare, why are so many people opposed to a government-provided health care option? I believe you, Senator Kennedy. I just promoted you. Government-provided health care for most of your life. And, you know, I would imagine that most of us here are on Medicare, and there may be some who would like to give up their Medicare. No, none of us do. So what is so wrong with government-provided health care? And I have one more question. In the proposals you were suggesting, I didn't see any way to control costs. That's been one of our major problems, not only the denial of care, the of care by the health insurance companies, but that the costs have gone out of control. So how would you propose it? How would your system control it?
But I'll send you a copy of that poster board there. But I don't want to get into the Mayo Clinic, but ma'am, in all due respect, here's what they said. The proposed legislation misses the opportunity to help create higher quality, more affordable health care for patients. In fact, it would do the opposite. That's a fairly clear-cut statement from Mayo. Wellness and fitness, risk pools, ability to go across state lines to purchase health insurance, reform medical malpractice, give people a $5,000 family a $5,000 refundable tax credit to go any place in America and get the health insurance that they think best meets their needs. Eliminate this problem that this wonderful nurse now was just talking about of hospital readmissions, which is a tremendous increase in costs. We can do so many reforms and so many things we can change if we're incentivizing wellness and fitness as well without adopting a government plan. All the way in the back, the young woman with her hand in the air, and then I'll go back to you.
Thank you, Senator McCain. I am concerned about health care not only for me, my children, and my unborn grandchildren, but I feel that this has got a lot more to do than just health care. For the first time in my life, I am concerned about my freedom. To bypass the Constitution. I would like to know if that is even possible, and if they're going to do it, do we get a say in it? Because I want the right to speak my own mind and make my own decisions.
I say on the issue of freedom, I just came back from a trip with Senator Lindsey Graham and Senator Joe Lieberman and Senator Susan Collins to Yemen, Afghanistan, Iraq. And I can tell you, we have the freest and most wonderful nation in the world. I believe we will protect your freedom. I don't think that the second part of your question was that
I heard there are people that are going to. I've heard that
I know what you're
trying to
yeah.
redo the
Well,
Constitution.
what you're referring to, my friends, is that some years ago when we adopted a budget process, and I know that when you start talking about this, you get a thing called MIGO, my eyes glaze over, but basically there's an arcane mechanism that you can, by 51 votes, pass certain provisions because of the budget process. Now, we keep hearing that the Democrats want to use this, what was intended for budgetary reasons, to reform health care using that mechanism. It's called, quote, reconciliation. I am worried about that. I am very worried. I thought all along, if they couldn't ram it through and get 60 votes, that they would try at least some part of it through the 51-vote process. I am unalterably opposed to that. It would be a drastic change in the way that the United States Senate does business, and I hope that if you see something like that coming, you would not allow that to happen. Thank you for the question. I want to continue to protect your freedom.
Thank you, Senator McCain. It's a privilege to be here. I am an American. I'm not part of the mob. I came here for a reason, and that's to learn, and I support this. I got a couple questions. When I was in school, Jack and Jill ran up the hill. I could understand that. This stuff that comes out of Washington now that's in legislation, bills, they don't even know what's in it. How can we expect to know what's in it? Why can't we just have a simple verse, simple statement saying this is this, this is